In this chapter, I'll be giving an overview of the 8 major joints of the body. These 8 joints determine the range of motion for almost every yoga posture. In addition, I'll be introducing 2 key concepts, tension and compression. By examining these concepts closely, we will learn to discern the difference between muscular restriction and skeletal restriction. By recognizing these differences, we will be able to determine if and how a yoga posture can be improved. In subsequent chapters, we'll look at the movement of the bones in the shoulder, the spine, and the pelvis, and we'll conclude with a look at proportion and orientation. This DVD is about primarily 4 ideas, 4 conceptions, and elaborating them. Those 4 conceptions are compression, tension, proportion, and orientation. Now, right now, that might not mean anything to you, but it's compression and tension, proportion and orientation. Hopefully, by the end, will mean everything to you about how and why you or someone else does their yoga differently and what they can do about it. And of those 4, the first 2 are really going to be dwelt on. That is compression and tension. When you practice your yoga, when you teach your yoga, when you or your student cannot move into where you want to go, that restriction that you feel is of one of 2 types. Not one type, 2 types. It could be compression, where 2 things, usually bones, are hitting together and can't move anymore. Or it could be tension, where the tissues are not elastic enough to let 2 bones move apart. These are the 2 opposites, the yin and the yang of yoga. Is the pain, and not necessarily a bad debilitating pain, is the discomfort, the stress of a pose that you're trying to do, is it compressive stress or is it tensile stress? This makes all the difference in yoga about how you can change that or not, how you would try to change that or not. So I'm going to spend most of our time together, at least in the beginning, emphasizing compression, 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 because as yoga practitioners and yoga teachers, you're very familiar in your own subjective experience and in teaching. What does stretching feel like? How can I get more stretch out of this? How can I make that guy stretch more in that pose? And what's not talked about enough is its necessary complementary aspect, compression. Is it because 2 bones are hitting together and that's why you can't move? If that's the case, how you go about trying to change that is totally different than how you go about trying to pull it apart. Compression and tension. When you do or teach a yoga pose, there are 2 types of stress that you might be feeling, not 1. I'm going to try to outline the 8 major joints of the body where compression is going to occur. Whether you're a beginner at yoga and it's going to happen for you a year from now or 2 years from now, or whether you're more experienced in yoga. You've already stretched out your muscles, your tendons, and now your bones are hitting. Everyone experiences compression. We'll try to start with the most obvious examples of compression in our limbs. It's easier to feel, easier to demonstrate. And then we're going to move in towards your pelvis and your spine, where it's harder to feel, a little harder to demonstrate, but the principles are exactly the same. First area to show is how much you can rotate or pronate your hand, which is really your forearm. I grab hold of my elbow like this because I don't want to cheat and use my shoulder to do it. I touch my elbow in this way, grab it gently to remind myself, don't do this. Only do it from the elbow down. If I lay my hand open like this, the two bones in my forearm are parallel to one another. One bone, this long bone here, the ulna, it doesn't move. But this bone on the outside going down towards your thumb, it does move. That's what enables you to turn your hand over. Supination, pronation. When I try to turn my palm all the way over, at some point compression here occurs, where soft tissue is compressed in here, and I can't rotate over the top anymore. Parallel, crossed over. So now with flesh on it, parallel bones, trying to cross the bone you can't see, over. When that can't go anymore, it's due to compression. It's not tension. It isn't because something hasn't been adequately stretched that I can't do that. So for me, I start here, rotate, there's 90 degrees, there's another 45 degrees, slightly past that, maybe 135 degrees or so of rotation. But if Erin comes up and does this range of motion, and she holds her hand like this, these two bones in the arm are parallel to one another. When she rotates her hand over, it's crossing, 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 but look how far she can go. So if we have Erin do what I just did, if we have her hold her arm here, just to remind her, don't do it from your shoulder, only do it from the elbow down. And we ask Erin, turn it out as far as you can. She can actually turn past parallel. Now I say, start your rotation maybe 90 degrees, and I say, okay, about there. And then for me, I could go about that much further, and then I was done. Erin can go another 45 degrees to there, another 45 degrees past that, and almost another 45 degrees past that. And that's because of the shape of her bones, what she was born with. Yoga didn't develop that. That's just the skeleton that she has. Yoga hasn't developed this in me. It's just what I have. Thank you. Where will this come up? What difference does it make what you can do with your wrists? It comes up anytime I place my elbows on the ground or arms straight and try to put my palms flat. So for me, if it were my goal to put my palms down, that's all I can do from the elbow down. The only thing else now I can do to get my palms the rest of the way to the ground is to rotate from my shoulder, which means my elbows are going to go out. If I try to keep my elbows in, I can't have my palms on the ground. If I extend my arms, same thing. For me to put my palms flat on the ground in a pose like this, it's got to come from my shoulder. That's why my elbow's going up, elbow's going up. If my elbows stay down and in, my palm will come off the ground. For Erin to do this, she doesn't have to do anything with her shoulder. Just palms flat. So let's test it and see. Erin comes forward, kneels down here the way that I did for you, places her forearms on the ground. She's already palms flat, showing me up. Remember, I was here, and I'm trying to put my palms down, and I was stopped right there. That's all I could do. Erin, palms down, no problem, because of how she can rotate here. Even if there was a hole dug out here in the floor, Erin could still put her palm on the edge because she can turn over that much. So Erin never has to use her shoulder rotation to place her palms on the ground. So if Erin goes into a moderate downward dog, for Erin to keep her palms on the ground, she can do any correction up with the shoulder she wants. And look, she can keep her palm on the ground. Elbows rolled in this way, elbows rolled out that way. She's got so much movement from the forearm down, she has an option of how she wants to manipulate her shoulders to keep her palms flat. I, with my limited range of motion, don't have an option. If I'm in this pose and my elbows are in this way, which is really a shoulder movement, my hand's going to be up off the ground. And the only way to put that down is to roll my elbow, which is my shoulder, down like that. It's easier to see it when the elbow's bent, but it'd be the same shoulder rotation if the elbow was straight. Okay, thank you. So this comes up in any forearm balance that I might do. Headstand, scorpion, downward dog. Even if I turned around and went into the wheel, trying to keep my palms pressed, my hands, palms flat to the ground. Not having as much range of motion as Aaron or someone else could make a huge difference in which joint am I moving to keep that palm on the floor. So here's a little principle that goes along with this. It comes up again and again when you're analyzing yourself or someone else. It's called the axis and the extremities. The axis of the body is sort of like it sounds. Anything closer to the center of the body is the axis. Anything further out towards your fingertips or your elbow or further down towards your knees and your feet is the extremity. Don't let the tail wag the dog. If you're one of those that can put your palms down flat in certain of these downward dog or forearm balance positions, that's great. You're probably doing it mostly from your forearm. But don't compromise your shoulder or hurt yourself here close to the axis because your extremity can't do it. If your extremity can't do it, don't punish the axis of your body. Axis and extremity. In yoga, because it's easier to see our hands and it's easier to see our feet and our knees, they're not covered over with thick muscle and under our clothes, we tend to look at ourselves and others by looking at the hands and looking at the feet, assuming that's telling me what's happening here. I look at the hand, assuming that's telling me what's happening here. I look at the foot, which we'll see later, assuming that's telling me what's happening up here. And what we're going to discover is that's not always the case. But because it's the easy thing to see, the easy thing to correct, we tend to focus on those things. Focusing on the extremities at the expense of what's happening at the axis is a mistake and will lead to frustration and injury. Two people who look the same on the outside when they're doing a pose are not feeling it the same on the inside. And this is the easiest example to give you. If you looked at Aaron and I, and we're both balancing on our forearms or in downward dog, and you looked at our hands, and I was wearing long sleeves so you couldn't see my elbow and how it was twisting. You looked at our hands and say, okay, they're both doing it the same way. Nothing could be further from the truth. I'm rotating 45 degrees in at my shoulder to make up for what my forearm won't give me. Erin, with her exceptional range of motion, could actually rotate her shoulder the opposite way 45 degrees and still have her palm flat on the ground. And yoga won't change this because this is compression. If it were due to tension, if there was something that could be stretched, something was too tight. I'd never done yoga before and I'd had my arm in a cast. I might not be able to get this full range of motion because of tension. Well, then I slowly, eventually get to here. But tension is not a resistance here. I feel no stretch anywhere that's inadequate. I feel only compression, and there's nowhere to go. The next most easy place to discover tension and compression and contrast them is moving up the body from the extremity towards the axis is the elbow. If you can see, The bone in the forearm that can rotate and move is no structure part of your elbow. The bone that doesn't move, the ulna, that goes down to your little finger, it forms a hook-shaped bone that fits right into that notch right there. And it pivot around, pivot, 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 until bang. It bangs, the end of this little hook bangs into the back of that socket. Now there's nowhere for it to go. And that's a form, again, of compression. A more aggressive and easy to feel compression. Here, it just sort of slowly squishes together till you can't squish anymore. But here, as the very sharp edge of a bone hits another bone cavity. So this is very easy to distinguish this compression. So again, if I go like this, I can't go anymore because of compression here. If I'd had a torn bicep tendon and I had surgery on it and I hadn't stretched it yet and I was going to rehabilitate myself, I might have to do massage and therapy and stretching to stretch this bicep out again so I can get my elbow straight. This is tensile training, tensile training, tensile training, tensile training, compression. What I have to recognize is the type of training that I did to get to that point is now inadequate to change what's happening from here on. If I were to think to myself, you know, it took me a month to get to here and another month to get to there, well, then another month I should be down at this angle, and another month I should be down at that angle, and I should get good enough to just whirl my lower arm in a circle. Why doesn't that occur? Because of bony compression. This is tensile, 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 compression. What can I do to change this? In yoga, safely, probably nothing. It's just the way that it is. It might be good for some things and bad for others, how much you can extend your elbow. If you look at Bob, if I turn Bob's arm like this, it looks like he's bent here. It looks like if you said to Bob, straighten your elbow out, it looks as if he's not paying attention to you. Say, Bob, straighten your elbow out. Doesn't happen. And what's more, when I tested this earlier with Bob, we have worked together before, he said it's always been like that. It's either he's got a large protruding part of the hook that goes into the elbow, or a shallow socket that's receiving that hook, or both. There's nowhere to go here. If I said to him, okay, Bob, just let me help you with that. This is not yoga, this is jiu-jitsu. If his arm was like this and he had scar tissue here, and I'm taking my thumb in there and rubbing it so hard to break apart the scarring, and I'm pulling his arm like this, now I'm helping him because I'm stretching out tensile resistance. Or he's doing yoga for himself. But once we get to here, either he does it by himself or I'm helping him, there's nowhere to go now. This is not bad or evil to do this. It might actually be healthy for the bone to have a moderate amount of compression put upon it. But to go bang, 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 push hard to make it bend further, that's a huge mistake. And it's simple and easy to see in the elbow, but this same principle comes up in our backs, and our hips, and our hamstrings, and our knees, and it's harder to feel it there. So I'm spending more time on what probably seems very obvious to you, because this principle illustrates so clearly the difference, the problems between tension and compression. And in yoga, if this wasn't our elbow, if this was our hamstrings or our back, we'd be going, God, I love this yoga. It's making such a huge difference in my life. I'm opening up so much. This is amazing. I feel so good. And it's like, I'm not doing as good as I used to, and I went to this workshop, and I hurt myself. Because at some point in there, we didn't recognize it changed from I was training the tensile tissues that were resisting this movement into the compression. That's why it's so important, why so much of this DVD is emphasizing compression, compression, compression. Because all of you have been attracted to yoga and do yoga because you love how it stretches you. You probably don't need any help from me or anyone else to learn how to feel a stretch. What's harder and is not emphasized enough in our training is when is it compression? And what do you do to modify your training if and when it is compression? So now what I'd like to do, to contrast how much I could bend my elbow, let's call this normal. How much Bob couldn't bend his elbow, you'd call that hypo. Now let's bring up someone who is hyper. But please bear in mind, these are totally arbitrary things to say. Okay? It doesn't mean there's something wrong with Bob or wrong with me or wrong with someone who can bend more than me. These are arbitrary things of what deviates from 180 degrees. So let's bring forward Giselle. I hold her up, and this angle here is more than 180 degrees. I was about here. Bob was about here. Giselle is there. And I've worked with people who have an angle that goes off down like this. Is there anything Giselle has done wrong in her yoga to date to make her hyper-mobile in this extension? No, it's just what she was born with. Could this work against her or for her in certain yoga postures? Yeah, might, maybe, but you don't know ahead of time. I've had students who can hyperextend, again, which is an arbitrary standard to say they're hyper, who can hyperextend a great deal. And they hyperextend in all of the arm balancing postures, except maybe handstand. They hyperextend in the wheel, they hyperextend in downward dog, and it feels great. For them not to hyperextend would be the equivalent of average folks like me not straightening my elbows out all the way. You'd feel like, gosh, I'm not exploring everything that's there, but I'll hold myself back. I don't know why, but I will. And there are other instances where, because of how the bone is shaped in their musculature and another 100 other variables about them, if they were to do the wheel or the downward dog and completely go into where they can hyperextend, that they can feel a strain at the elbow that someone like me wouldn't feel. The point here is not to try to predetermine for yourself or anyone else, is it good or is it bad? Is this good or is it bad? That's not helpful. It's not helpful to try and come to that kind of decision, and it's unnecessary. This may be very good for certain things, very bad for others, or completely indifferent, that she never feels herself compromised in any pose. Whereas Bob, at the opposite extreme, he might also feel, no, I feel fine in every pose, I just don't get it all the way straight like everyone else. Or Bob might go, I never like to do downward dog, because as soon as someone pushes on me to make me go deeper into downward dog, I get a big strain here. But you don't know ahead of time, because there are so many other factors. But what we're trying to point out here is that this is going to show up when I do a downward dog or a wheel. And is it right or is it wrong? Is it helpful or is it not helpful? It varies from case to case. And why would you punish someone like Bob, whose range of motion is here, and say, gosh, you're never doing the wheel correctly because you can't get your elbow straight? Well, he's never going to get his elbow straight because of the shape of the bones. How can that be incorrect? Or, he's got Giselle bending like that. If she's not in any pain, why would I make her back off and go to here? Why would I say, no, you can't explore the full stretch of the joint and get that feeling? I'd only do that or advise her to do that if she was experiencing pain here. But there's no reason to determine ahead of time what's the right angle of extension. What should it be? This big, broad piece of bone here is called your scapula. Hanging from it is the humerus. This shelf over the top of the humerus bone, this large bony shelf, which is part of the scapula, that's called the acromion process. It's probably one of the only Latin words you'll ever need to know because it's going to come up again and again and again because we use our shoulders so much when we move. The acromion process, which is a flattened extension of this ridge of the scapula. When we raise our arms up in this fashion, sooner or later, for everybody, the humerus hits the acromion. But everyone's acromion process is differently shaped. Some it's tilted up at a higher angle. Some it doesn't overhang as much to the side. Some it doesn't overhang as much towards the front. Those variations lend for huge variations of when is someone going to reach compression. Now for everyone, no matter how flexible or inflexible you may be, when you bring your arm up and you don't let your elbow go out to the side, this is called abduction, you don't let that arm abduct out to the side, you keep it in. When you bring it up, you're going to hit the acromion the soonest possible instant that you can. If I let my arm abduct out to the side, I can go around the acromion process. Now I will be compressing here on the back side between these two bones, but it's not as painful and not as aggressive. As you can imagine, this has huge consequences for when you do a wheel, when you do a downward dog, whether elbows straight on Vrishkasana, doing a wheel, or Dvipada Viparita Dandasana like this. Anytime I need to draw my arms back, bent or straight, when compression occurs, it's over. Later we're going to see how the scapula movement adds to how far I can move. But right now we're just looking at this joint. Just this joint for now. And like the elbow, like the wrist, and like all the other joints we'll see in the body, the ultimate restriction is bone, what you were born with, what you came to yoga class with. That'll be the ultimate restriction. If the overlying musculature is tight, you might not know what your ultimate range of motion is because you can't stretch your muscles enough to get there. But after you've done enough yoga, then you're going to be stopped in your yoga postures by compression. Okay, let's turn Bob this way, same way I turned the skeleton. If you could get up here and feel on Bob's shoulder, say, wow, there's the acromion process right there. Here's the humerus right there. I ask Bob to relax. He trusts me. I raise his arm up, relax your muscle. I push up, relax more. It's like he can't go up any higher than that. I'm holding his scapula down so he can't cheat. And his arm can't go up any higher than that. Look at the angle of his arm to his ear or his neck. That's it. So I hold her scapula down so she can't cheat and do this kind of stuff. So, okay, don't do that. And I slowly start to bring her arm up. Now that was Bob. Remember Bob? That was Bob. That's me. This is any normal person. This is Ivy's mother. And this is Ivy on some type of steroid kind of diet. I don't know what. Bob, here. Ivy, here. Bob, Ivy. Okay? Yoga is not going to make Bob into Ivy. Because Bob wasn't complaining down into here of, oh, my latissimus, my pectoralis, my coracobrachialis, my tricep, they're too tight. That was not a complaint. That would have been a tensile complaint. It's not stretched enough in here. Bob was the same. He had pain right here. Ivy has pain right there too, but I got to push her all the way back to there to find it. Now Ivy is also at compression, but her compression is here. Okay? This is what Ivy walked into the yoga class with. Now if Ivy had been a bodybuilder or a fastball pitcher, and she'd torn her rotator cuff, and this had had surgery on it, and this had all been scrunched down from surgery, and she'd never really had worked it again because she was afraid. She might have come to the yoga class and done downward dogs and eagle postures to stretch that out, and she might have been very tentative. Oh, I don't want to pop my shoulder out of the socket again. I don't want to injure myself again. But slowly, patiently, methodically, she had a good yoga teacher who was like, okay, we're not going to push you too hard, but we're going to keep working you. You got to keep working, Ivy. That's not going to get any better. You go like, oh, wow, look at this. Wow, oh, I can almost pitch again. And then it gets to here. And what brought her to here will now not take her safely any further. Because this has all been stretched out. There's nothing more to be stretched. What's now stopping her is compression. And once again, compression is not bad. Compression is actually good for the bones. To gently compress the bone is a stimulus to their growth and their density. But it's one thing to do a wheel or a downward dog, gently get yourself to a point of compression and enjoy it. And another to, here, help me. Pull me back this further so I can bend further. That could be injurious. Ivy's going to demonstrate for us the downward dog. But before we get there, I'm going to do this with her. I'm going to ask her to stick her butt out so she doesn't lose her balance and give me her hands. So she bends over more and more and drops her chest down towards the floor. Right there, I'm staring at an angle at her shoulder that's about 180 degrees. Now, if she drops further down, fall into me a little bit. Look at her shoulders go back. She can go back that much because we're letting her roll her elbows a little bit. But even if I didn't, even I said, Ivy, turn in like that, don't let your elbows roll out. Look at the angle of her shoulder. If I let her wing out, if I let her go around her acromion process, it's like incredible. Even hitting, going onto the acromion process, drop down again. It's an incredible range of motion. Now, what do you think her downward dog is going to be like? Ivy goes into downward dog. She places her hands down, and I step in her hand so it doesn't slide. And I say, okay, Ivy, keep those elbows in, keep those shoulders in. Even so, we know from having seen her before, she can get so much hyperextension, bad word, but that's how it's described, at the shoulder, that's not a problem for her. I can actually dig a hole out for her head and push her down further. And if I let her wing her elbows out like that, she could dig a hole to China and still have her head on the ground. Walk your hands, come up, please. So when you saw Ivy, a ground's eye view of Ivy is this is just stretching under here. This is being pressed into her back. Feels really good. And Ivy is literally, if her hands and her feet don't slide, hanging out. Right? If her hands and her feet don't slide, it's a tensile suspended pose. Correct? Now, if we bring, thank you. If we bring Bob back, we know Bob is nowhere near flexibility of Ivy. Most people aren't. So Bob gives me his hands. He sticks his butt out. He bends over. And then he bends his knees so he doesn't have to worry about his hamstrings. Stick your butt out. There it is. I can't get Bob's arms in the same line as his back. Do you remember where Ivy's were? It's like I can't get, and I'm letting Bob's elbows wing out to the side. I'm letting him go around that acromion process as much as he can with his shoulder. It isn't going. If I forced Bob by grabbing his wrists and rolling his elbows and shoulders, not the elbow so much as the shoulder in, now look at the angle. It's even worse. And is it because Bob can't stretch under here? I guarantee you Bob is feeling the pain there on the top where compression is happening. When we take Bob into a gentle downward dog, you think Bob's going to put his head on the floor? Knowing nothing else about him, he could have the most flexible hamstrings you've ever seen. But will he ever bang his head on the floor? No, because he's never going to draw his arms, his head through the arms like that. So let's test our prediction. If you'll place your hands down, Bob. So I'm going to let Bob keep his knees bent, if you will. Bring your feet up a little bit closer to me, Bob. And if I tried to push on Bob like this, I am. It's like, am I going to help him open up his shoulders? No. Because he's experiencing compression right there. I might not hurt him, and he might actually enjoy doing downward dog. He might like to put his hands against the wall or on a block or something. Thank you, Bob. He might actually enjoy the downward dog. It might be a great feeling to just get that much out of it, to get the stretch in his arms and shoulders. He might enjoy it. But is Bob's downward dog ever going to be like Ivy's downward dog? Never. It'll never happen because of the shape of their bones. If two people look the same on the outside and how much they're bending to do a pose, they're not feeling it the same on the inside. Just imagine if Bob levered himself into his shoulder so deeply that he looked even remotely like Ivy. Do you think Ivy would be having the same experience in downward dog? Bob would be sweating bullets, probably doing something detrimental to his shoulder. Ivy's just hanging out. Or what if we did it the opposite way? And so we make Ivy only bring her arms up, or in downward dog, her head through, as far as Bob. Now would they be feeling it the same way? No, because Bob is totally relaxed, taking the strain into his shoulder. Ivy is contracting to artificially hold herself there. If two people look the same from the outside, they're not feeling it the same on the inside. Because no one's skeleton is exactly like someone else's. Next, very simple, the neck, the cervical vertebra. We're going to demonstrate, does compression occur going backwards the same for everybody? Does compression occur going forward the same for everybody? You would think a very simple movement like that would be the same for everybody, but even in a very simple movement, due to the different anatomical proportions and bony constructions that cannot be changed, you'll see that it's not the case. If I'm normal, which I'm probably not, I drop my head back and you can almost see I go back pretty far. Mikey, perfectly healthy, strong young guy, drops his head back, that's it. Now, if it were tension that were holding him back, where would he feel it? Somewhere here in the front. His windpipe would be stretched and his voice would be strained, his muscles here would be contracted. But if you ask him and you touch him and you palpate him gently, you go like, look, he's just tight back here where my hand is. Due to the shape of the bones in his cervical vertebra, he just compresses here before his head gets as close as someone else might. But when he goes forward, perfect elongation. The only reason Mikey can't go any more forward than this is because of compression in the front. He can't drive his chin through his sternum any more than that. If his chin wasn't touching his sternum, you might say, well, maybe there's tension here. So again, if you say that I'm normal, I'm probably not. I drop my head back, it's about like that. Alex drops his head back, and it's about the same. Much different. Both of us are very different than Mikey was. Now we come up. I'm sort of a normal guy. I can bring my chin to my chest. Mikey could bring his chin to his chest. Alex can't bring his chin to his chest. Now, just looking at him, we wouldn't know. Is it because he's too tight back here? That would be a tensile problem. Or is there something deep in his cervical vertebra, the vertebra of his neck, where that's as far forward as he can bend? Well, I go like this, and he'd have to tell me where he feels the strain. And if he'd been doing yoga for a while, a year or two or whatever, and didn't have some catastrophic car accident that he hadn't told me about, pretty much everyone is going to stretch out these ligaments and muscles enough to put their chin to their chest in a year or two, barring, accident or illness or something. So when Alex comes down, he goes like, I'd ask him, Alex, have you ever been able to put your chin to your chest? And he goes like, not in memory that I ever thought about it. So assuming He's done enough yoga, assuming that's the case, that it's not a tensile thing back here. If I aggressively try to push his chin to his chest to make him look like me, or make him look like Mikey, or make him look like anybody else, because I think somehow this is wrong, I'm going to hurt him. And if he thinks he has to go down to get his chin to his chest to make him look like everyone else, he's going to hurt himself or become frustrated. Because all of our bones are different. And Alex can't bring his chin to his chest for the same reason that Mikey couldn't bring his head all the way back. It was not a tensile problem, it was a compressive problem. Amy brings her chin to her chest, no problem. Most of us think everyone can do this, but we just saw with Alex, that isn't always the case, nor can all of us do it with the same facility as someone else. Now, how about bending backwards? That was, about to here was Mikey, perfectly healthy, perfectly normal. That was his point of compression. Here was Alex and I, about here, maybe slightly like that. This is Amy. Now, is she hyper or are we hypo? It's just an arbitrary standard. It's an arbitrary thing to pick. Oh, let's just flip a coin and pick the middle. It's like she's perfectly normal, perfectly healthy. Mikey, in his range of motion, was perfectly normal, perfectly healthy for his bones. Alex in his range, me in my range, all of us, all four of us, are finding compression in this direction and compression in that direction. And that's just the way it is. For the lumbar spine, we have Ivy as very flexible and Michael not very flexible. Ivy gets down on her hands and knees, and she arches up like a cat. And what we're going to test is the opposite motion. But first I want to show you this. Anything with a rib on it isn't going to move that much. But down here, below where the ribs stop, this area, how much this moves is the lumbar spine. So Ivy arches the other way. That's a healthy bend. Why can't Ivy bend any more than this? If it were tension, she'd be feeling it here. I can't stretch that way anymore. But she feels it in her spine, in her bones. Where do you always feel compression? In the bones. If I jammed Ivy very aggressively here in her back, I could break her spine. Because she's relaxing to let me compress her as far as she can go. If she uses her stomach, if she tightens up the tension here and shortens it, she can push against my hand and arch up. And if she's strong enough, I'll never bend her back. I can't bend her back because tensile strength, tensile contraction tightens up the arch. I can't bend her. I have to ask Ivy to relax that tensile, let this elongate so that can stretch while this compresses. And now, I can always push her a little bit more than she could herself, but look, that's as far as she's going to bend. And if she tries to do more than this, it might be injurious to her. If he comes down on his hands and knees, his spine is now suspended between this and this. He's like the Golden Gate Bridge. This is the column of compressive support. He could stay there forever because I'm pushing straight down through the bones. Compression. This is compression support. He might not be able to stay there forever because he has to use his muscles to keep his elbow straight, but he could bear a lot of weight here. It's compressive. This is slung between the two. And if he relaxes the cables, the bridge is going to sag. And that's it for him. That's as far as his bridge is going to sag. He's got compression happening all down through his spine. If I jammed him hard here, I could injure him severely. If he didn't want that to happen, he'd contract powerful abdominal muscles, push back against my hand. I can't not injure him now because of tensile integrity on the front holds that arch. If this was being stretched out, if he'd had an injury or something, if he relaxed this slowly, this is elongating to allow this to sag. Now, why can't I go down anymore? It's not because of anything tensile in the front. It's compression right on the spine. And that's where he's going to experience it. If he'd been injured, maybe he's here, and he's not going down because he's not elastic enough. But if we've trained him properly with yoga, he can't relax more than that. It's not because he's hanging on with tension that he's not going down. It's compression now. And if I ever tried to make him like Ivy, who we saw earlier, we'd break his back. They're different. They were born different. They will always be different. Their yoga will always look different. We're going to examine one point of compression here at the femur. And that point of compression, an anatomist would call abduction. If I bring this leg out like this is the femur, the trochanter, or the neck of the femur, is going to hit against the lip of this acetabulum, it's called, the hip socket. And everyone's bones are shaped differently, just like you saw in the neck and the elbow. Everyone's femur is shaped differently. Everyone's acetabulum is shaped and positioned differently. So where this hits is different on everybody. Now, I'm keeping the pelvis level on the skeleton and raising the leg. The demonstration I'm going to ask a couple people to demonstrate is, let's get the legs apart about this wide, and let's tilt the pelvis like that. Let's tilt the pelvis until the pelvis tilts over and we get compression. But it's still the same. Whether I keep the pelvis level and raise the femur up, or whether I keep my feet and my femur on the ground and tilt my pelvis towards it, I can no longer tilt my pelvis that direction when compression occurs. So we're looking at the bowl of the pelvis, so the rough shirt line or belt line of a model. I ask her to straddle her feet apart a bit, so she's already slightly abducted. I have her put her hand right here on her hip, and I want her to tilt her pelvis this way until she cannot tilt her pelvis anymore. So don't lean into it with the spine, just the pelvis, right there. Now, if there were restriction here, that would be tensile. If she couldn't stretch her leg in through here, that would be tensile. But that's not what's restricting her. She has purposely placed herself so that she has compression right there. Now, if we let Ivy reach down, the rest of this movement is from her spine. The pelvis is not tilting anymore. If she comes up, boom, how far she could tilt her pelvis was that much. So she's got much less. She's already here before her spine even engages to take her down the rest of the way. Okay, and that's all spine. So again, Sherry stands, feet a little apart. She's already slightly abducted. I'm going to have her place her hand right there, so she's indicating to herself and to you where is she going to start to feel this compression. She sticks her hip out to that side. That's it. Ivy was like this tilt of her pelvis. If it were tension, if it were here, it would be tension. If it were here, it would be tension. But Sherry's feeling it right there. I can't go over any further because of compression right there. So now if we say, okay, you've done that well, push your hip over, and now go into triangle pose, the reason she could even get close is because she's got a pretty flexible spine. Okay, Sherry, we'll make it easy for you. Feet wide apart. Stick the hip over. That's not going to change how much she can abduct, how much she can tilt. Now she tries to go down. It is possible, it's not true in this instance, it's possible Sherry could have had the same flexibility here as Ivy. She doesn't, but it could have been. Nonetheless, because she doesn't have the pelvic tilt, she's never going to go down the way Ivy did. Okay? But you could imagine a situation where someone only had the tilt of Sherry, but had an arm that was 4 inches longer and a spine that bent like Gumby. So both Sherry, this mythical Sherry, and Ivy would be doing the triangle pose or the side lean, but they're not feeling it in the same place. two people who look the same on the outside are not feeling it the same on the inside. The knee, if it's straight, does not rotate from the knee down. But if it's bent, it does. But again, because everyone's bones are different, how much you can rotate is different. And that's what we're about to see. I have Jean on the floor because I have to have the knee bent to twist it. If the knee is straight, this is not a twist of the knee, this is a twist of the femur. But when it's bent, she flexes her. Now, just from the knee down, she can rotate. Now, how much can Jean rotate? I'm going to grab it, and I'm going to turn it out this much, and she can go about to there. That's about 45 degrees, maybe slightly less, 40 degrees. And then I'm going to grab it, use the foot as a lever, and take it in that way, and it hardly goes. So she barely gets a few degrees turned in, and she gets less than 45 turned out. So her whole range of motion of what she can do from the knee down is maybe 50 degrees or so. If she tried to do any more than that, she'd be seriously threatening the integrity of her knee and asking for trouble. Again, if the knee is straight, leg is straight, this movement of the foot is not indicative of what's happening in the knee. It's indicative of what's happening at the femur. But if we allow her to bend, scoot up just a little bit. If we allow her to bend and I flex her foot up, flex this, I'm going to move it for her to make it a little easier. I go, that's about 45, 50 degrees out to the side. And this is about 45 degrees, slightly disguised by the ankle, in. So you add those up together, she's closer to 90 to 100 degrees of rotation, about double of what we saw Jean do. I mean, it isn't because one did yoga different or did a different yoga style. This is the bones you're born with. I've had students who can do 135 degrees of rotation from here down. You have it or you don't. Finally, we made it. We've gone through 7 points of compression that are going to come up in most of your yoga practice. Started here, worked down the spine, down the hip to the knee. Now the final one is the ankle. Now once again, there can be a tensile resistance to how much you flex your ankle, and there's a compressive resistance to how much you can flex your ankle. If it's tensile, it will be the Achilles tendon, which connects to your calf, that will be stretched. And it'll be stretched on the back side when I try to do that. The Achilles tendon attaches right there. And if I try to do that, it stretches. If it's compressive, it'll be on the front side of the ankle. The bone will hit. If Annalisa will kneel down like this for us, and yeah, that's fine, and start to bend her knee. As she tries to bend her knee more, to sink down more, right now her heel's starting to come up. Why is the heel coming up? Because of compression here. If it were tension, she'd have a burning pain here in the Achilles tendon, because she's got a lot of leverage forcing that knee forward, hundreds of pounds of force. She's going to have a little tension here because she's at her extreme, but it's not holding her back. Annalisa's ankle is coming off the ground as she tries to push her knee forward because this angle is not improving. It's compression, bone on bone. She could stay here, and it might be healthy for the bone to compress it once in a while, to stimulate the bone to growth, to keep its density and its health. But is she going to bend anymore? No. This is a compressive problem. This being the case, do you think that Annalisa can squat down and keep her heels on the ground? So try. I'll give her a hand so she doesn't injure herself or anything. She would like to stick her knees forward to counterbalance her butt. But to do that, her heels will have to come off the ground. That's as far as she can go. Is she weak in the thighs? Is she tight in her butt? No, none of that applies. It's just here. All this down here freezes her up here because of this. What if we give Annalisa a board? We've given her that much range of motion to her ankle to start with. Now can she go down and keep her heels down? Look how much further. Can you go any further, or does the heels come up? Yep, keep going. All of a sudden, she's flexible, she's younger, she's stronger, she's sexier. No, all we've done is compensate for her what this little joint all the way down here was making her look more awkward than someone who has great ankles. It wasn't strength, it wasn't flexibilities. Only at the ankle was that a problem. And we'll start again facing this way. We use the same ankle. We put the knee back on the ground. I bend mine. It's not, mine's sort of like normal, I guess. Maya starts bending and she stops. Annalisa was here. Paul is here. Real people are here. Freaky kind of people are there. And Maya is kind of like down there. Look how level her thigh is, almost level, because of this. She's got compression the same way Annalisa has compression. But due to the shape of her bones, the ankle and the arch of the foot, due to that shape, her compression is at this point. She also feels a little bit of stretch here, but it's not holding her back. Do you think that she'll be able to squat down with her heels on the ground? There's no doubt about it. Go down slowly, and let's see where Maya stops. There's Annalisa right there. Because Maya's knees can go forward. Keep going. Go all the way down. All the way down. You have it, or you don't. We've seen Annalisa's very supple, very flexible woman. If we have her bend forward like this, into a forward bend, we can see that, look, the tilt of the pelvis is not at all restricted by any tension in the back of her legs. This is without a warm-up, just pull myself down. So obviously, she can tilt her pelvis as much as you want, or she wants to tilt herself forward, and she can stretch her legs and keep her heels on the ground. But if we get her into downward dog, she's going to end up fighting against, again, this point of compression that she was born with in her ankle. And she will not be able to keep her heels on the floor, even though the stretch on her hamstrings is far less in the downward dog than it is in this pose. So we ask her to position herself into the downward dog, bring her hands down, walk her feet back to approximately where she would execute a downward dog. Now look, the pelvis is only tilted 90 degrees. She is nowhere near what her hamstrings would allow her. And she can push back as much as she wants. This is not on the ground. Is it because the legs need to be stretched up here? Does some tilting up here need to happen? No. It's because she cannot flex this ankle because it's compressed here. If we would allow her to use her hamstring flexibility, we'd have her walk her butt back by moving her hands back, and eventually, boom, she got her heels on the ground. So if she wanted to have her heels on the ground for some reason, if that aesthetic quality was important to her, she'd have to be at least this wide in her downward dog. But she's got more weight on her legs and less weight on her arms. She's not as effectively bearing weight in her upper body. If Annalisa wanted to use downward dog to train the strength or the flexibility of her upper body, she'd probably want to compromise, do my heels stay on the ground, walk herself out to wherever she felt comfortable working this pose, and now she can push and stretch and bend more because she's bearing more weight in this part of her body, more leverage to stretch herself or to strengthen herself. Stretch herself if she just lets it go, strengthen herself if she fights against it. Whether you do it yin or yang, that's your preference and how you want to do it. But she, because of the ankle, is not going to aesthetically please someone by having the heels on the ground and work the upper body. And even if she could drop her head all the way to the floor, it's not going to change this. It's two different segments of the body. So again, Maya's showing us, hey, I've got the hamstrings too. You ain't got nothing on me. I can stretch my hamstrings. I can go right to there's a point of compression and there's nowhere to go. Okay, so don't count me out just because I have good ankles. I've worked my other body parts too. But because of her ankles, Maya goes into a downward dog, and her ankles are on the ground. Maya can even walk her feet back a little further, and her heels are still on the ground. She might even go back further, but she might slide out from under herself and end up on her head. Because who has the better downward dog here is an aesthetic question. She now has fallen more into her upper body because of the wide downward dog stance. If she wanted to take more of the weight into her legs, she would walk her legs up. And this is where Annalisa had to go just to get her heels on the ground. Maya may never choose to do the downward dog this way. Maybe. Because she'd say, look, if I want a hamstring stretch, I'll walk my legs all the way up. If I want to work my upper body, either passively or contractilely, I'm going to walk my feet way back, because that shoves more of my weight into my upper body to give me something to work with or against. And to come up into any mid-range in between is neither a great hamstring stretch nor enough weight for my upper body. But this is just a hypothetical. I mean, she might choose to start in a very modest downward dog to warm up for one or the other of the extremes. But once again, how wide should the downward dog be? Depends on what you want to work. Should your heels be on the ground in downward dog? That may or may not be in your control, depending on how wide you're going to work. That little demonstration of the downward dog brings us to an important point. Posture should be dynamic, living things, not things etched in stone that everyone should do in spite of all their differences of proportions and flexibilities. When we look at a posture, whether it's the downward dog or any other forward bend or any other pose, a more profitable, less dogmatic way to look at it is rather than vote by conference what should it be if it were perfect, as if we were all the same, should just flat out analyze if it's wide, what's being stressed. If it's narrow, what's being stressed. If the heel's on the ground, does it make any difference? Maybe it does, maybe it doesn't. But every one of those variations that you or your students explore may be a very valid thing for them to do. Whereas the standard, whatever the standard is and whoever decided it was the standard, isn't effective for them. It's not an effective leg stretch and it's not an effective upper body stretch. It's just the standard that someone picked, probably with proportions much different than yours. So whether it's the downward dog or a forward bend or the lotus pose or a back bend or a headstand, whatever it is, we want to reach out of the box of what's the right way. Because what's right for somebody is wrong for somebody else. These postures, these wonderful yoga postures, have so much potential to do so many things. It's not effective or valuable to try to say this is the way. With a little anatomical training and a little bit of analysis of what's working what, I encourage you to encourage your students to play with these poses to see how it works for them. All variations are legal. All widths are legal. All hand placements are legal. All foot placements are legal. Are some of those going to be ineffective for some people? Yes. Are some of those going to be possibly hurtful for some other people? Yes. But just because that's the case, why would you not let anybody do them? Because they might get a lot of good out of what's killing somebody else. Why hold back a greyhound because the pit bull can't do it? Or vice versa.